That's all right. All right, everybody, looks like everybody got their thing done. How much was new information? Anything new?
Well, I haven't heard the terms.
We're gonna talk about these real quick. And then, according to the calendar, objectives are due today for that, and the objectives for the skeleton. And its quiz is due on Thursday. So that means you'll do the objectives on your own for the class, with partners, books, things like that. Then they're due on Thursdays, then we will lecture, if we need to lecture about those things, or move on. Okay? But we gotta get on track, and it's because we started in the middle of the week. By the way, this is recording now. You can find it, go to YouTube and search CASC-PTA. Now, we've got several videos up there, so you may have to look around for it, but I'll put A&P on everything that we do. What's wrong?
That would drive me crazy.
Is that an adjunct class or something?
Is that a what?
Is there a,
It's just delayed.
It's a few seconds behind.
oh, it's what's going on, oh, okay.
I shut the preview off. All right. My glasses. So who's feeling pretty skippy this morning? All right. You two get up here.
Skippy?
Oh, I was like
Oh,
sick,
no, I
I
thought
was so
you
sick.
said sickly.
No, I don't, you don't want me to get there,
I
you
take
don't
that
want me
back.
to be.
It's too late now. You've already gone here.
New one came in off the line. What?
Oh, how many times have I went to the bathroom this year?
Since you volunteered first, you can either be the demonstrator or the demonstratee. Which do you prefer?
I'll be the demonstratee.
All right. Turn around so everybody can see you. Oh, that, by the way, we gotta choose class officers at some point. So, class comes with a cash scholarship. I don't know how much it is. All right, so I want you to show your classmates flexion.
Okay, can I sit down? On all of it, can I just do one?
Just pick one.
I'm gonna do the other leg. This is flexion, the one going this way, like,
Going up
yeah,
or going down?
not going down, right? No, going down.
Going down.
Yeah, going down,
Yeah,
sorry.
going up is extension.
Yes.
All right, well, show me another flexion.
It's so weird not doing it with the laying on down. Flexion, right?
That's, what is that, Stevie?
Internal, external rotation.
Or lateral medial rotation.
I need to practice.
I
this
think the
stuff.
book, does the book use lateral and medial? Yes. So, lateral rotation is external rotation, medial rotation is internal rotation. I tend to use internal, I
said this together, causing an increase in joint angle. Should that be a decrease in joint angle?
All right, well, let's see, look here. If we were to place a goniometer on her elbow, everybody agree that her elbow can flex and extend, right? All right, so we put a goniometer here, it's out straight. Everybody seen a goniometer? Right. What's a straight line? Well, how many degrees is a straight line? 180 or? Zero. So in this case, this is 0. This is increasing the angle. Okay, so, yeah, that can be a bit concerning. But no, okay, glenohumeral joint, right? This is flexion, right? All right, so straight line here is simultaneously 0 and 180. So in this case, it's 0, and as we go up, that's about 90, right? About 135, 160, 180. Right? So that's where that comes in. You have to, it depends on your starting position. And we always start at 0. All right, so let's make it easier for you.
Sorry, I didn't been sick all weekend.
All right, let's put her in anatomic position.
Yeah, same. That way. Thumbs out. Feet straight. Okay. Does her feet have to be touching? I wasn't clear on her. Can I just, okay.
All right, that's anatomic position right there. There's another position that's very closely related to anatomic position. What is that? Fundamental position. What's the difference between anatomic and fundamental?
Put your hands the other way. Thumbs are in.
All right, so the big difference between anatomic and fundamental is that in anatomic position, the forearms are in complete supination. Okay, everybody's agreed that this is supination. Whereas in the fundamental position, the forearm is in neutral at 0 degrees. So, all right, now, show me a flexion. And it can't be elbow or shoulder, because I already showed you those.
Is it flexion in hand? So, flexion.
All right, she took her out of anatomic position. Is that still flexion? Trick question. Yes,
Why
of
would
course
it not
it is.
be? Okay.
Everything we do when we talk about the body, Rio, get down and put your hands and knees and your head on the floor.
Hands and knees and head?
There you go. All right, so now let's describe his olecranon process to his acromioclavicular joint. It's distal, yeah. It doesn't matter what position. If Rio could stand on his head, we could have him stand on his head. He could raise one arm out in front of him and the other leg behind him and twist his ankle. When we still talk directional terminology, we would still refer him back to anatomic position. Anatomic position, right? I will, you'll probably see some questions that I'll try to trip you up on that. But always remember anatomic position. Why do we have the fundamental position? That's a good question. The only thing I've ever come across that we needed to reference the fundamental position is next semester in kinesiology, you have to do a movement analysis paper. And some people choose the fundamental position as their starting, like they're doing like a hammer curl. So that starts in the fundamental position. Other than that, I don't know. Always reference anatomic though.
So no matter what you say, no matter what you try to, whatever scenario,
It's
oh,
anatomic.
it's referred to, go back to anatomic.
Yep. All right, show me. Hey, you pick somebody else to come up here. You stay here, Heather.
Oh my gosh. This is horrible. I feel mean.
You get over it.
Jaden. You're welcome. Thank you very much.
All right, show me abduction of anything, I don't care, abduction.
Abduction?
What is that, abducting? Right, let's start being as precise in our speaking as possible. This is the shoulder, right? But the shoulder comprises the shoulder girdle, which is the clavicle, scapula, to some extent the rib cage. Some places refer also to the sternum as part of the shoulder girdle. Whereas the shoulder joint is the humerus and the scapula. So altogether, it's the shoulder, or the shoulder complex, right? So when we're doing this, let's reference glenohumeral joint, unless we want to talk about the scapula and the way it moves. All right? So precision in our speaking as much as possible. And if you catch me being lazy, please holler at me. Abduction? Show me abduction of the wrist.
Wrist?
The radiocarpal joint.
With this one? No,
That's flexion.
that's deviation, isn't it?
Yeah, it's deviation, also known
Oh,
as.
okay, okay.
Right, so
Not that way.
now, Heather was trying to help her out here. That's a good thing that you didn't pay attention, because she went like this, right? Well, let's take this back to anatomic position. So she did adduction, or ulnar deviation, right? So it's a good thing you didn't fall for that.
That's right, I did.
So, that's what it is. So,
I got you.
radial deviation would be abduction, because it's moving away from the midline, right?
Yeah.
Okay, in this case, midline of the hand, and adduction is moving back towards the midline. Right, get somebody else.
Dana.
Let's see. Cal, what do you want her to demonstrate?
I don't want to be the bad person.
Like I said,
Everybody should be
if not, I'm gonna give her a hard one.
Plantar flexion?
Plantar flexion. Plantar flexion, everybody agree? Now, go ahead and show us dorsiflexion. That's dorsiflexion. How come we don't call it extension? Or dorsiflexion is flexion, and that is extension. I don't know. If you guys come up with an answer for that, I'd like to know.
Always wondered that.
All right. Choose somebody. That was easy. She gave you an easy one.
Miranda.
You studied that? Show me circumduction of the wrist.
I've already heard that term.
Of course you haven't, because you can't circumduct the wrist. What are the two joints that you can circumduct?
Little and then
More or less, or hip. Only one's that ball and socket. Good job. I'm glad you didn't go, ooh, go.
I probably would have tried to do it.
Show me scapular adduction.
I don't want her to.
Turn around.
Oh, you're
Turn.
fine.
No. Face me so they can see your scapulae. What's another name for scapular adduction? Causing the scapula to move towards the midline. I think somebody said it.
Retraction.
Retraction, yeah. Scapular retraction.
Two.
Okay. Passively, it's hard to do. You have to grab a hold of the humerus and do it. But let's have her do it actively. What instructions would you give a patient to get them to retract their scapula?
Towards.
What would you tell them, Stephen?
Make sure shoulder.
Squeeze your shoulder blades back together.
Inch shoulder blades. So scapular adduction is retraction. Scapular abduction is protraction. Okay.
That way.
What other joint can you protract and retract?
Temporal mandibular.
And you're the only one studying. Good job. I threw you a couple curveballs. See how well you do under pressure.
Do I need to fix something?
Yeah, I think so.
Rear.
Yeah, dude. Tell me.
Show me horizontal abduction of the little humeral joint. Horizontal. Dum.
Adduction?
AB.
AB.
Of course it'd be like that. Please, make your response in the form of a statement, not a question. All right, good. All right, everybody got a handle on these things? We need to go over any more? Yes, no, maybe so?
Maybe not a complete handle, but
You
we'll
wanna
get
see some
better.
more? All right, here's a tricky one, and it's something I need to show you, because if you started studying your cards, right, for Thursday, all right, tell you what, come up here, Steve, you got a t-shirt on, you sit down. Stay facing this way. All right. Remember from lab the other day, what this is called, what my finger's on right here? This, I'm on a scapula, a specific point. Inferior ankle, all right? You have the upper, middle, and lower traps in this round, don't you? And they're talking about upward and downward rotation of the scapula. All right, so we reference upward and downward rotation of the scapula by the inferior angle. The inferior angle moves up and in, that's downward rotation. And the inferior angle moves out and up, that's upward rotation, all right? Now, it's an accessory movement, meaning I can't say, okay, Stevie, I want you to downwardly rotate your scapula. See, you can't just do it. What happens is the traps fire in relation to what's going on at the little humeral joint. So, see my finger right here? Right? That's where it was. Now it's right here. See how much it moved? That's upward rotation. Okay? Upward rotation occurs when we go into flexion and abduction. Downward rotation occurs when we go into. Okay? So we're here. As it comes back to neutral, is that downward rotation? Yes, it is, because it's going
Down.
up and in, or in and out. Okay? As it comes into extension, it will roll. Now my inferior angle is clear over here. Okay? So what that does is that if he needs to forcefully push up against my, okay? Not only is he using his anterior deltoid, is that in this set or next set? This set? Okay. Not only is his anterior deltoid firing, but also the trapezius muscles, okay? You can feel, okay, relax, push up again. And you can feel those muscles contract. It makes it more efficient. Okay? So that's upward and downward rotation of the scapula. I don't know if you've been exposed exposed to that before. So, also, in your regular anatomy class, you were probably taught the trapezius as one muscle. The trapezius is one muscle, but functionally it's three, upper, middle, and lower. That's the reason why those cards break it out. Same with the deltoids. Did you learn anterior, middle, and posterior deltoid in your anatomy class? Or you just learned deltoids? Okay. Again, one muscle, the deltoid, but functionally three. So we need to break it up that way. That's the reason why you have those. I should have made mention of that last week, but time got away from me. All right. What motion is this? You can look at the lateral rotation, yeah? I agree. The book shows it like this, at 90 degrees of abduction, right? Okay. Which is where we'll measure it when we start goniometry, but we generally strengthen it down here. Okay. And we bend the elbow because if I'm, okay, if you'll notice my humerus went into external rotation, right? But it looked like I really supinated more. So, but it's hard to see if I go like this, so we do this, and you can see it better. Supination, pronation. Don't forget your trunk and neck, your spine rotates, plexus extends, and side bends. That was pretty easy stuff, wasn't it? What that?
Not too bad.
Everybody got their cards here? Let me look at mine.
I did like three and, but still the action.
All right, so this is how your muscle quizzes will go from here on out. I believe I found a way to be able to get these pictures up on your screens. It cost me $28, but I can do it. Yeah, that's your cue to feel bad for me. So, how are you going about studying what this is? Brute force? Upper trapezius. Outer. Is that how you're doing it?
I have a question on one of those where it connects to the coracoid process. It says coracoid process of the scapula. Do we have to put of the scapula because it's part of the scapula?
Yeah, and there's only one coracoid process.
Yeah, so I didn't,
No, you can just use coracoid
Okay.
process. When, I won't count off on it, I'll encourage you to be specific, but like when we get into, originates from the lateral epicondyle. Okay. Now, most of the time we assume it's of the humerus, but we have more lateral epicondyles in our body. So try to be as specific as possible. I won't count off for it if you don't put lateral epicondyle of the humerus. But just try to remember to do that, to be more precise. proving to be harder?
Action.
Action and nerve?
Action mainly.
Yeah, mainly the action.
All right, I need to get the PowerPoints for this class in on these. Which I don't think I did I? Oh, there's one. This is getting into a little bit of chapter 5, the muscular system, on helping to figure out the action. Muscles are dumb. They only know to contract. Okay? So, all right, come up here, Rio. I need a string. Actually, you got that one.
Can you take video?
All right, so the origin is where the muscle comes from. The insertion is where it's going to, right? The action is what it does, and the nerve is what the nerve is. Right? So, let's turn around here. Give me the origin of the upper trapezius. Occipital bone, nuchal ligament, right? So, there, right. So it's coming here. Where's it inserting at? Okay, so it's coming across like this. Okay, lateral third of the clavicle and the acromion process, right? Right, so when this thing contracts, look at your picture, okay? Can you see how it would upwardly rotate that scapula? Because remember, upward rotation is when the inferior angle comes up and out, right? Does it have another one? Elevation, right? So can you see how if I were to be able to contract this, a scapula would elevate and upward rotate? Okay. So the thing to do is to, especially when you're first starting to learn about these, turn on here, turn. Let's take one that's easier. It's not in this section of cards, but let's take the biceps. Okay. Biceps originates off the supraglenoid tubercle, or yeah, of the scapula. It comes down, it inserts into the radial tuberosity of the radius, right? So, my fingers, okay. So if I went like this, what's his forearm gonna do? Flex. And it will also, since muscles are dumb, supinate, flexes and supinates, okay? So, think about the origin and insertion of it, okay, and then think about, action is probably one of the easier things for you to do. If you get the origin and insertion in your head, then you could imagine it doing this, okay, it does that. Right. Anterior deltoid. Somebody give me the origin. Okay, so it comes here, where does it insert? Right about here. Okay. So, if I were to do this, can you see how the humerus will flex? Okay. Also, it will slack because it's here and the fibers come around in this direction. Pull that up, Rio. It's going to come in about like that. Pull in that direction. Right. So when he contracts it, boom, it's going to do that. And because the origin is slightly anterior to where the insertion is, it will internally rotate or medial rotate the humerus as well. the nerve that does the axillary, you mean? Axillary?
Yeah, axillary, yeah.
Right.
I call it that too.
So now you study however you want to. Here's my suggestion. Okay, let's take the deltoid, anterior, middle, and posterior deltoid, for example. I would group them together simply because, in my mind, I know that the insertion point is the same for all three. I know the nerve is the same point for all three. Right? So I'd spend a little time getting that in my head, and then I would concentrate my efforts on where does it originate. And then I would rely on my good God-given common sense to get the major action of it. Because that middle delt, right there. What does the middle delt do? What's its action? Shoulder abduction, going humeral abduction. Okay. And then the posterior delt. What is it? Its action? Extension and external rotation. Or lateral rotation. Now, go ahead, Sam. What you'll, how I'll go about grading it is we will grade it in class. We'll take it and we'll immediately grade it. Alright? And I'll enter your scores right then in the grade center. But, let's see, posterior deltoid, shoulder abduction, extension, hyperextension, lateral rotation, and horizontal abduction. 1, 2, 3, 4, 5 things. You have to get the majority of them, so you have to get 3 on this one. Okay. Anything that has just 2 actions, you have to put down both actions. 1 action, obviously, that one. If it's 3, you only have to put 2. Okay. And they generally list them in order of importance of what they do. So, when we talk about the glenohumeral joint, is this extension or hyperextension? Hyperextension. Right. This is extension. This is hyperextension. Now, that makes great and good sense until we get to starting to measure it. And then, when you measure it goniometrically, this is extension. We'll cross that bridge when we get to it, though.
I'm freaking out a little bit,
Oh, it is?
just to let you know. Yeah, I was kind of in a haze, I guess, last Thursday. I didn't study. So this may be my first one of all.
Oh, no, you get it. Everybody gets it. We've never ever lost anybody because they couldn't do the muscle cards. You might be, no, I'm just kidding. All right. We'll go over these a little bit more. We're gonna talk about directional terminology.
How many cards are on the first test?
10.
Did you tell us all that?
They're in your course calendar and syllabus as well. All right. Stevie, you're a guy. Come up here and take your shirt off. You can get flexible. You're not super hairy, so I can draw on you.
Well, not up here, because you'll go see me.
All right. So, inferior angle, superior angle, spine, Roman process. And you find the AC joint right here. Okay. Now, you got your cards out? let's look at the rhomboids. Okay, read off the origin of the rhomboid.
It's the names process of C7 through T5.
So C7 through T5. So I can come down, first little bump I hit, boom, C6, and the next one is C7. Okay, and then I can count down 1, 2, 3, 4, 5. So runs from about here. What's it insert on? Vertebral border scapula. And it pulls in that direction, right? Does that look about like the card?
Yeah.
Okay. So, if you were to contract this muscle, what's gonna happen?
It's gonna pull the
So retract,
elevation.
slight elevation, and a little bit of downward rotation.
They always pull towards the origin, right?
Correct.
Always.
Always to the origin. Pulls from the origin. Yeah, the insertion always moves towards the origin. And most of the time, I can't think of one off the top of my head right now, but most of the time, the origin is the more proximal segment than the insertion, because it's the most stable. All right? Now, what other one are you having any troubles visualizing any of these others? Let's do levator scapula. Take your upper trapezius and your levator scapula. Look at it. One of these muscles is superficial, the other is deep. Do you know which one is deep? The levator scapula. So if we really wanted to get at the levator scapula, what we'd have to do is we'd have to come in here and cut the upper trapezius, pull the upper trapezius out of the way, and then we'd see the levator scapula. And it goes like this, right? It just takes a little elbow grease to get this off. So, that's one of the other things I want to bring up, the difference between superficial and deep. Because the cards really don't do it justice. So if you have a question, ask me, ask somebody to look in the book, that way. Because a lot of times folks look at that and go, oh, I don't get it. They're both in the same spot. Serratus anterior.
Lateral surface of the upper eight ribs.
Alright, raise your arm up here. Alright, you can see his serratus anterior. Push up against my hand a little bit. Alright, turn so everybody can see it. Okay, you see this right here? Okay, that's serratus anterior.
Turn this a little bit more.
Push down against me this time. No, that's not helping. Push in front. There we go. See how they're popping out? Alright. Serratus anterior, it gets its name because it looks like, it originates here. It comes back. Okay, what it does is anterior to the scapula. So it's between the scapula and the rib cage and inserts onto the vertebral border of the scapula. Okay, that's a hard one to picture. Okay, but what it does is it comes, it wraps around, goes underneath the scapula, but then inserts there. Okay. Just turn around. Put your arm down. All right. You ever heard of winging of the scapula? All right, winging of the scapula is when you have this serratus anterior gets weak. Okay? And what happens is the vertebral border comes off like this, because the function of that serratus anterior is when it pulls, it goes clunk. It pulls this down tight on the rib cage. All right? Now, what you can see right here, see how his scapula are kind of sticking off his thorax? Okay, that's not the way it should be. So, would this be winging of the scapula? Does he have this weak serratus anterior? This is a trick question. I don't think he does. What I think he has is a tight muscle that's in this group, that's on the anterior side of the pectoralis minor. Okay. Pec minor comes off of ribs 3 through 5, inserts on the coracoid process. So, when it gets tight, what it does is it pulls the scapula and pull the inferior angle off. Okay? So, if we wanted to get these nice and flat out length and allow that scapula to fall back down. When it comes up, that's called scapular tilt. When it comes off the vertebral border, it's called scapular winging. A lot of times scapular winging gets misdiagnosed when it's scapular tilt.
Would you do overhead with the dumbbell to stretch that, pectoral minor? How would you stretch that?
You stretch pec minor just like you stretch pec major.
Okay, just,
There's no way, unless you manually, I can manually get behind his pec major and grab hold of that pec minor, okay, and I can manually stretch it, but that's not comfortable, is it, Steve?
not really.
And he doesn't have any pathology on that shoulder, so. Let's see. Rhomboid, delt, levator, upper trap, lower trap, serratus anterior, we did pec minor. That's it. Thank you, sir. So what I'll do Thursday is and if I can get the thing put up here on the board, it will go just like it's in order, because it scrolls. If not, then I'll mix them up, and I'll just have to call them out to you.
So you're just gonna ask us one thing?
One of the 4,
Okay.
and I'll just randomize it. I asked the one that happens to catch my eye at the moment. What's the nerve to the anterior, middle, and posterior deltoid?
cranial nerve there.
Axillary.
Oh, you said delta.
Deltoid.
That's the track though, isn't it?
That's tracts, yes.
Okay.
So what I would do is I'd try to group them so I didn't have to remember as much. Say, okay, all these are axillary nerve now. Okay, look at that, they happen to all insert on the axillary deltoid tuberosity. And then they go around in a circle. Anterior, middle, posterior. When it gets hard, is when I get into the stinking wrist and fingers.
That's what I've heard, that's bad. This seems bad right now, but we haven't studied it.
All right, so Thursday, what we will do is take our quiz, first rattle out of the box, grade it, record it, and then we'll clear up any issues with the skeletal system.
And that's worth how much?
What?
The quiz?
This quiz,
Just
10 points.
10 points?
They're worth a point apiece. Then you'll have pretty much 8 to 12 every week. Until we get to the end, and then we'll have 1 or 2.
Action and nerve only.
Action and nerve only. All right? Nothing, you good? We We go to module 8.
Okay. I know, I just saw it.
Yeah. We're going to,
Module 8, can't remember what that is.
Bring that up last week.
Also, you have Easter as a Tuesday. I think it's a Thursday.
That figures.
Is on that Tuesday instead?
Yeah, so we're out Thursday and Friday,
Yeah.
not Monday and Tuesday. I hope it's Monday and Tuesday. Yeah, we'll just do the quiz before.
I gotta run the library, are we?
We're done. I'm done with you if you're